and it is reaction to Professor Taole Mokoena, who has been appointed the new Health Ombudsman. Professor Alex van Den Heever from the Wits School of Governance joining us now to react to this new appointment. Professor, good morning to you, and thank you for your time. What do you know of or about the work of Professor Mokoena?
Well, the only information that I have is there's a report published this morning by the Daily Maverick, which examines his past and demonstrates that the proposed ombud has substantial commercial and other links into the ANC, and therefore doesn't look like an independent candidate, which is what you would require for, or at least a candidate who has no conflicts of interest and no interests other than performing these tasks independently, as we have grown used to with the former ombud. And so this is troubling, because in essence we don't then have anybody who's basically going to hold the system to account for all the failures that are currently occurring within the public health system. It's really concerning. We need an independent person. And I think what I'd stress about this is there is a fundamental problem in having a minister appoint such a person, because if the implications of that appointment are to cast aspersions on the political party or the governing party in power, then they're going to appoint somebody who's going to be soft on them. And that's why you don't allow conflicts of interest in such appointments. And unfortunately, these are structured into the legislative framework. And clearly, there's been concerns raised with at a political level with somebody who's been independent in the past, and now that has to be addressed clearly.
Well, let me perhaps ask you this question. Professor Xoli Mngambi, she does not deny her previous links to the ANC as having been a member, and there she was, a very independent public protector who was not afraid to hold the very government that is led by the ANC accountable. Are we not putting the cart before the horse?
No, I don't think so. I think that the issue is that you could say that Xoli Mngambi was clearly recognized as an error and subsequently corrected, potentially. We haven't had a public protector like her since. So that was kind of lucky for the public, that the public protector's office suddenly became a real office for a period of time. And because it was real, it meant that there was a big focus on who gets appointed into that position subsequently. And the same with this one. In this particular case, the ombud has been independent. But the question now is whether somebody makes absolutely sure that the person who's going to be appointed will be somebody who will kind of toe the party line, so to speak, and to make absolutely sure that they don't, by mistake, select somebody who might have an affiliation with the party in some way to make them acceptable, but will actually behave independently. So this is the problem, is that we should not allow politicians to have this discretion. We shouldn't be having anybody appointed with political links. And the vetting and the independence has to be unimpeachable, very, very clear and demonstrable to the public. You shouldn't lose confidence in such people and such officers because of their affiliations and conflicts of interest with the very people they're meant to be overseeing and investigating.
Well, perhaps the conversation we should be having, Professor van Den Heever, is what you are raising now in this second response, that ministers perhaps should not be appointing such people because there will be that temptation to want to employ a yes person in a position. Isn't that perhaps the conversation we should be having, much like what the president did in his appointment of Shamila Patoy, where he lives the process to an independent process, so to speak, in order for the right candidate to be appointed? Party links, that could be a tenuous discussion, don't you think?
Yes, so what you would want is a process that selects the best candidate for the job, and that what is not in the mind of the people making the selection, that this person could embarrass them. And what we're permitting is that all of our systems of accountability are compromised because and become fake. They don't become real. They're veneers because the people appointed into those positions can whitewash what's going on. So at a structural level, you're correct. The key discussion we have to have is in all of our systems of accountability, we can't allow for a discretion. Even in the case that you mentioned, it was a discretion for the president to set up such a process, whereas it should be a requirement, not a discretion. Mm. And processes of proper vetting and properly choosing candidates cannot be up to just political parties and even the maneuvering within Parliament, because they don't select the best candidates either. And what you want is to have an objective process which has a clear understanding of the purpose of the office, and that it is and the best candidates are chosen. And this should be the top of the people who are selected in the leadership positions in the South African police services and the military, in all investigative structures, in the NPA, etc., and all regulators. Yeah. And if you go through all the books now, go through all the legislation, you will see that there is political involvement and discretion in all of these appointments. And what it does, and what we're seeing today, is the consequence of failures of systems of accountability, which have resulted in the collapse and the hollowing out of public institutions and private, because public institutions regulate private institutions. So what you need is to make sure that the regulators are not partial to certain interests.
Let me conclude the conversation with this question. The clinical experience, or should we say his level of knowledge of the public health care institution. An academic, he is a recently retired chief surgeon. He also has participated in panels which investigated surgical deaths, for example, at the Chris Hani Baragwanath, as the minister was recounting for us. Does that count for something in terms of him being able to execute on the job of attending to complaints from members of the public?
Being able and being willing are two different things. And we've got many people with those qualifications. So the question is, why this one? So we have a lot of people with very, very sound medical understanding and clinical understanding of health services and functions, governance arrangements, etc., and they haven't been considered for selection. So why this person? So to me, the issue is having the qualifications is misdirection, because the question is, will they actually be deploying their knowledge and competence to actually form part of an accountability structure which requires them to actually to be harsh to the very people that appointed him. Yeah. And I'm not sure that is why he was selected. Too much is problematic in this background when we have many, many candidates that could have been chosen.
Professor Alex van Den Heever, thank you very much for your thoughts there, reacting to the appointment of the new Health Ombudsman, Professor Emeritus Taole Mokoena.